ASH is working to advance key legislation at the federal level to improve health outcomes through advocacy efforts. The Grassroots Network Lunch takes place annually and serves as a forum for interested hematologists to learn about ASH's legislative priorities and how they can participate in ASH advocacy efforts. I'm here with session co-chair Dr. Holter-Chakrabarty. Doctor, why is it important for hematologists to get more involved in advocacy?
So I think when you're talking about what you can do for patients, it's absolutely critical that we know that we teach our government what we need. They work for us. And with hematology, things are very, very difficult sometimes to understand. And so being able to tell those patient stories to our government officials and help them understand how their legislative actions actually directly affect our patients is absolutely critical. Everyone can do it. Everyone should. I think it is one of the essential things that we all have to do as physicians so that we can make sure we advocate for our patients.
Do you have any suggestions on how members can get more involved in advocacy?
Oh, I have so many. Let's start with, if you go to our advocacy webpage, there will be an action join now. You can join the Grassroots Network, which we're going to do today, but you can also, when you join that, there are action alerts that will go out. So whenever we have a policy update that we really want to influence, it goes out to all of us. We can all then click on it, put in your name, and it will actually identify who your legislature person is and help you create an email that you can immediately send. You can also use social media if you'd like. That is critical because we're going to all, with the same voice, we're going to tell our government what we need, and we're going to do it all together so that they can listen.
Great. And so what are some of ASH's advocacy priorities for 2025?
Wonderful. So with everything, we are looking for the cures and the better treatments for all of our patients all the time. The only way we can do that is through NIH funding. So we always advocate to make sure that we keep our PhD and MD colleagues that are in the research field funded so that they can make those cures. So that's just how it happens. Secondly, access to care is absolutely critical. If you don't have access to the appropriate subspecialists, like someone with sickle cell disease that needs a hematologist, you're not going to get the best care. They may or may not know the guidelines that we've created through ASH that help provide that great care. So we're trying to improve that access. We are actively trying to improve sickle cell disease therapy, and we're trying to get data collected through the program so that we can make sure that we have the appropriate data to make the appropriate decisions, and we're trying to create comprehensive health care for these individuals, which is absolutely critical for everyone, but certainly critical for sickle cell disease. Lastly, Medicare reimbursement. We have to be paid for what we do so that we can see the patients that we see. And so we are working to try and make sure everyone understands that it's just we're asking for the time to care for our patients.
Very good. Well, we look forward to seeing how all of these advocacy efforts pan out in 2025. And thank you again for spending a few minutes with us here on ASH News TV, Doctor.
So important, and thank you.